episode of the Let's Chat Derbyshire podcast, a podcast about mental health, suicide prevention and neurodiversity. I'm Luke and I work in Derbyshire's public health, mental health and suicide prevention team. We hope you're doing well, and today we're lucky enough to be joined by Holly from Kooth.
Hi.
Hi. If you're not already, don't forget to like and subscribe to the podcast and do comment below and give us a review if you're listening on Spotify. Just before you introduce yourself, Holly, we'd like just to check in with our guests, see how you're doing. So out of 10, how are you doing today?
Oh, I'd probably say about an 8 today.
That's
yeah,
good.
Quite excited to be here.
Yeah.
A little bit of a stressful drive, but other than that, it's all pretty good.
That's good, yeah. That Friday feeling, I think, for me today, it's definitely kicked in. So just to get us started, Holly, if you wouldn't mind giving a bit of introduction to who you are and then a bit about, Kooth as a service.
Yeah, of course. So my name's Holly, as you might have guessed. I'm currently a senior engagement lead for Kooth. A bit of background about me. So way back in the day, I've got like a performing arts background. Yeah. So that was what I studied, but quite quickly moved into more like community work. So arts and mental health and things like that.
Nice.
And I think that's what sort of transferred me into this role, really. Worked with some of the like mental health charities, and then here I am now.
Yeah, no, that's great. And yeah, just I guess Kooth as an overview before we really dive deep into it, if you wouldn't mind just giving that overview of what it
Yeah, of course. So we're a digital mental health and wellbeing support service. So it's all online. It's just kooth.com. So it's pretty easy to remember. It's specifically for young people. Yeah. So 11 to 25-year-olds can access the site. It's all free. It's all anonymous. So win-win all round, really.
No, that's great. Yeah. Just before we talk, a bit more about Kooth and how it can support young people, if you wouldn't mind just sharing how you've, looked after your own mental health, any struggles you may have had,
Yeah, I think particularly like when I was younger, teenage years, I think everybody kind of goes through that maybe phase of, struggling a little bit. So definitely in that period, finding things a little bit difficult. I think it's been just kind of getting more comfortable in my own skin and with myself. A lot of kind of like self-acceptance, learning to like open up and talk to people a bit more, and also really spending time and taking time to do the things that you enjoy. Yeah. So I think at one point I was probably just focusing just on work, and although I like working, you obviously have to have time to do the things you like, so like your hobbies and interests and stuff. So like for example music and going to watch live music, make sure I get time to do that as much as possible now.
No, that's great. Yeah, you've given a bit of an introduction to Kooth of what it is already, but I guess how can it support a young person through the digital support it offers?
So it's really kind of diverse in what it can offer. So it is completely up to that person that signs up how they use it. So we offer kind of a full mental health toolkit, if you like, but we don't sort of prescribe how a young person uses it. So there's kind of different sections on the site. So you've got things like live chat with the practitioners. That's available until 10 p.m. each and every evening. Amazing. But then we've also got loads of self-guided things. So we've got like mental health and wellbeing activities. There's a journal space, goal setting areas. We've got discussion boards. There's like a podcast and articles section as well. So it really is kind of something for everybody. Yeah. And young people can kind of use all of that, some of it. They can change up week by week what they do. So
that's really good. So I guess when a young person signs up, they can just access all of that straight away and find what suits them. In terms of the, talking to a professional, talking to other people, how does that work? Can they just, message them and then wait for a reply, or? Yeah,
so the live chat is kind of that more instantaneous back and forth chat. So that's available every day. Monday to Friday, it's 12 till 10 p.m. And then the weekends, it's 6 till 10 p.m. Okay. So they would just click live chat. They send that initial message, just detailing a little bit about what they're experiencing, join a chat queue, and then when they get to the top of that queue, they can have an hour chatting with that practitioner about whatever that concern is. Yeah. So they're still anonymous. There's no like webcams or anything like that. But that person then will kind of listen to them. They'll support them through that experience and then help them to sort of move forward in the best way possible.
That's really nice.
Yeah.
What are some of those next steps usually,
Yeah, so they can either just do drop-in chats as and when they need them, obviously between those opening hours, but there is also the option after a few kind of initial assessment chats to do 6 weeks with a named practitioner. So if the person behind the screen and that young person feel that they would benefit from kind of a bit more structured support, they can kind of follow that pathway really rather than just kind of dropping in as and when.
Yeah, that's really nice. And I guess if they don't need that more structured support, like you said, there's the discussion boards and stuff.
Yeah, absolutely. And they can also use all that other stuff alongside the chat too. So it's it's not sort of like pick one or the other. Yeah,
that's really good. The discussion boards then, what sort of is it sort of topical, like themed sort of stuff, so they can find a discussion that's, I guess, supports what they may be struggling with, whether it's, you know, identity and stuff, or is it?
Yeah, so they're all kind of categorised. There's different kind of like headings that you can click through, and then it will like narrow it down a little bit.
Yeah.
There's quite a wide array, so there's pretty much everything from kind of like hobbies and interests, maybe like experiences of bullying, like you said, like gender identity, all those kinds of things. But yeah, they can either just kind of read, look at the advice that the people have given, or they can like post their own question. They can give that advice themselves. And it's quite nice that it's all like pre-moderated as well.
Yeah.
So if someone does sort of post a comment, it won't go up right away. It always gets like pre-checked by the team just to make sure there's no like bullying or trolling or anything like that going on.
That's really good. Things I saw when I was having to click through was about a coping box, and there was loads of other, I guess, coping mechanisms that were on there. I don't suppose you mind just sharing about what the coping box is and how, you know, a young person could build one up.
Yeah, so that would be part of the mini activities hub. So that's one of like 30 activities that they can find on the site. Yeah. So it's just getting a box to start with. So it could be like a shoe box or just any kind of small box. Yeah. And then they would fill that with things that are helpful for them. So it's kind of helpful to relate it to like sensory items. So if you're thinking of things you can either like hear or feel, smell, etc. So it might be that they put like a scented candle in there, or it might be that they put their favourite, if people still use CDs, they might put a favourite CD in there, or, you know, it could be about remembering to use a podcast or a certain playlist that they like listening to. And then kind of when they do go to use that, putting some time aside to then kind of think and reflect, like, how did I feel before? How did I feel after? Does this kind of relax me in a certain way? What's helpful? And then that can help to the young person to kind of learn going forward what is more helpful for them. Yeah,
that sounds really, really useful, and nice to know that there's loads of other activities that they can take part in. It sounds like it's a real support package for any young person, really, isn't it, that needs that sort of support. I guess, looking at the website as a whole, is there any other little tricks it has up its sleeve to support young people, really? Is there anything that you really like about it? That, you know, if you're speaking to a family or a young person about utilising it, what's your, I guess,
Yeah, I think, like I've already said, the fact it offers that choice and autonomy, I think, for me anyway, is really important, because I think particularly, you know, young people in schools, a lot of things get decided for them. So I think it's nice that it has all those options. One of the key things I think is really cool is the journal space. So even within that, there's a bit of choice. So they can use it daily. They can either just put how they're feeling using an emoji, so no words or anything, literally just that kind of visual, or they can also expand underneath with text. So across, say, like a week or a couple of weeks, if they use that every day, it can be a really good way to track like any trends, any triggers. And again, that option of, you know, if they're not feeling like they want to talk about it or write about it, they can just have the visual. Equally, they can expand. And it's also, again, like all moderated by the team. So if a young person, say, put something that was a little bit of concern or something like that, then the team would catch that, flag that, and then reach out to them. So it can be a good way then to maybe get them into, say, getting a bit more support, a live chat, or even just signposting them to an article or something that would be helpful.
That's really nice. Yeah, it's nice that even though they are trusted to, you know, use it, but they're not alone, are they?
Absolutely,
I don't want to say they feel alone in terms of, you know, they're doing it by themselves, but it's nice that there is someone, I guess, supporting them through it without having that direct contact, really,
definitely.
That's really cool. So I guess with the journal, they can look back and really track how they've done. That's so cool. That's really useful. We've spoke about, you know, a lot about what Kooth can offer. A crisis service, it does offer a range of support.
Yeah, definitely. So it's not kind of exclusively crisis. We do a lot of work with like prevention and that kind of thing, but it also kind of moves through that full spectrum to more crisis support if it is needed. So it is really useful for kind of a wide range of young people, I would say.
Yeah, it's really good. I guess, it's an important one around the prevention as well. A young person doesn't have to just access it when they need it. They can use it as a tool to support them through just life, really, isn't it? Like you said, it's
definitely.
a range of things on. It doesn't have to be just when they are needing that support, I guess, which is, you know, really nice. It's a nice general tool, isn't it, that can be used.
Yeah, and I think it's useful as well because if they're getting if they're on like a wait list, or perhaps they're getting support elsewhere, but they feel like they need something in the meantime, they can still access Kooth because there's no sort of thresholds or barriers or anything to meet with that too.
Just straight access. really easy to set up an account as well.
Yeah, literally takes about 2-3 minutes. You can do it like on your phone, laptop, tablet, like as long as it's got internet, you're good to go.
That's so good. If I guess anyone's listening who supports young people, is there any advice, I guess, around how they can support them to get them, onto Kooth or to utilise Kooth?
Yeah, so really simply, you can just bring it up in a conversation. Hopefully now, like you've listened to this, you might know a little bit more about it, or you might have done some of our training and stuff in the past anyway. So you can just kind of signpost them to kooth.com. We've also got loads of materials that you can give them, like a leaflet or a wallet card that's got a QR code on, so they can scan that too.
Oh, nice.
But also, if the young person is like happy for you to sit with them and talk them through the process, then you can kind of show them how to do that. It's literally like 7 steps. So like I say, it only takes about 2-3 minutes. It depends obviously if they're happy for you to do that. But if, again, both of you are, then that would perhaps be a good thing to kind of support them through. And then once they've got the account, they can just go off and see what they think of it.
Yeah, no, that's really good. And yeah, it's important to mention, yes, for any resources, if anyone does want any Kooth resources, Kooth provide us with them, and then we can send them out to you directly. So we'll put a link in where they can be ordered from, as well as other resources. We'll put a link in to Kooth. But I know you provide the training sessions. We did one, quite a lot of people joined and stuff. We can, if you are interested, Kooth, you've got a newsletter, haven't you?
Yeah.
And you do send out information on there about it. How can someone sign up to the newsletter?
So it's as simple as getting in contact with me.
Amazing.
So they could either obviously get in contact with you, and then you could pass them on to me, or I'm happy to share my professional email if needed at some point.
That's fine. Yeah, we can pop the email in the description at the bottom.
Yeah.
So if you do want it, drop Holly an email, and she can support with that. We don't want everyone to bombard you, but you do come and do school visits as well, don't you? But,
yes, sometimes virtually, sometimes in person. Just depends on kind of the schedule and my location and stuff. But especially with it being free. Yeah, nothing's free nowadays.
No, it's not. And I think that's a good thing about the website, isn't it? That it's not like it's free to join, and then you've got to pay this to get access to this and access to this.
Yeah.
It's just all free for the young person to navigate around, try bits out, and find what works for them.
Yeah.
And I think for anyone who's listening who supports young people, that's the important bit of it, is that they can just figure out what works for them.
Yeah, definitely.
And help them find those mechanisms and stuff, and it could be something that they can continually use, dip in and out when they need it. Once they've made that account, they've got the account, haven't they? And it's them, up to them when they want to use it.
A top tip actually in terms of them making the account is there is no way to recover their password.
Okay.
So obviously we don't take any personal info.
Yeah.
So if you are signposting a young person to Kooth, the top tip is to say make sure you either note down your password somewhere really safe and secure, or have something in your head that's going to help you remember it, because otherwise they'll have to make a whole new account.
Right. That is very good.
So that's
my
top tip for the day.
Make it a password that's not too easy to guess.
Yeah, absolutely.
but one they will know.
Yeah, one that they're not going to forget.
Yeah. But like you said, there's a lot of safeguarding things in place to support that
definitely.
young person if they do need it. Just before we round it up, is there anything else you'd like to add in terms of the support Kooth can offer? Anything about the service, or just any,
I think just to go off what have you said about being confidential, obviously there is kind of measures in place for if someone does present in crisis. Obviously the clinical team are all like fully trained and they're experienced in that, so they would implement things like safety plans, crisis de-escalation, and only in the most kind of severe circumstances they would pass information on to the relevant services. That is just to kind of help protect those young people. But other than that, it is all anonymous. And then, like we said earlier, if you do want to book any like staff training, it's all free. Any kind of school assemblies, sessions, that's all free. It's just getting in touch with me, and then resources, either myself or you guys.
No, it's really good. And,
multiple choice for that one.
Obviously, we're talking just about Derby and Derbyshire, but Kooth is nationwide. So if you do know any young people, there is in other areas across the country, is it as well? It's not. Yeah,
so we're not quite 100% yet, but a large majority, I would say. So if you are in a specific area and you're interested, just get in touch and we can see if we're.
So outside of the one-to-one chats and stuff, you mentioned about send a message.
Yes.
Start a chat. Yeah. I think. Don't mind if you just explain a bit about that and how it works. Yeah,
so I guess it's just explaining the difference between the live chat and the send a message function. So the live chat is the one that is Monday to Friday 12 till 10, and Saturday, Sunday, 6 till 10.
Yeah.
But outside of that, young people can also do the send a message function.
Okay.
So that is a bit like an email inbox on the site. They can send that message, whether it's like an inquiry, a query, or just looking for a bit of support, and then the team can get back to them within 24 to 48 hours.
Nice.
So that's just like another option if they don't want that live chat, or the live chat's shut at that moment.
Yeah, it's really good that that's there as a, sort of backup, so they can still get the information they need, and don't have to just wait for the live chat to be open.
Yeah,
so that's really good. Lovely. No, thanks, Holly. It's been great to talk to you, and like we said, we will pop in all the information regarding resources, the link to the website, your email in regards to training or school visits, and yeah, it's just really useful to know. I think if anyone does volunteer with young people as well, likewise, having those resources can just make it a lot easier to open up those conversations, or just to hand out to the young people. If you're not confident enough having those conversations, that's fine. But knowing it's here, knowing it's there, and accessible 24/7 in terms of the whole pan. Yeah, really useful. So yeah, thank you.
No worries. Thanks for having me.
No, cheers. So yeah, you've been listening to the Let's Chat Derbyshire podcast. Don't forget to like and subscribe. If you do leave a review, it does get it out to more people within Derby and Derbyshire, so that'd be much appreciated.